Hi guys, welcome to my YouTube channel. This is Building Tables with Charity Claire, and today we're having our public health segment because I am a public health practitioner. So I'd like to talk about the 100 million that the MPs are getting, Ugandan MPs are getting. Should we quit our jobs and become MPs? Yeah, there are 529 slots. Should we quit our jobs? Anyway, if you like the sound of that, stick around and let's have a conversation about this. I want to bring a public health or a health lens and to this just to expose some of the expenditures and what we could be using the money for. But definitely stick around and feel free to subscribe, like, and share. But most especially, let us engage in the comment section. Yeah, let's get to it. Well, the Ugandan MPs are slated to allegedly received, some of them received 100 million. Yes, and if we give each and every one of the 530 MPs or 529 MPs this money, that would be around 55 billion. That money exists in this country and it can be given for to MPs. Yeah, the people that we chose to represent us. So let's discuss about this. What can that do? What are the deficits in the budgets? 100 million Ugandan shillings. And as a public health practitioner, I was just wondering, when we learned about fiscal space for health, like how much our country spends on health, Uganda actually has never been able to meet that. Uganda has never met the threshold of the health budget. So I think we need to actually be able to at least spend at least 15% of our entire budget on health. And we've been struggling, honestly speaking. As a nation, we've been struggling. And we've made a few steps here and there, but then we've been struggling, honestly. And to hear that there is 100 million to be given to every MP. Now, hold on. For those that are not familiar with the Ugandan legislative makeup, we actually have over 529, approximately 530 members of parliament. Yes, for a population of about 45, I think, or above 45. So if each one of them actually receives 100 million, Ugandan shillings, 100 million Ugandan shillings. My first question is like, do we have that money? Yes, the first question that I have is, do we even have that money as a nation? Because if we struggle to meet our health budget, of late, recently, USAID kind of plugged out some of the funding that they have, and they've been funding quite a lot of our health initiatives and our health care. You wonder, where are our priorities? Where are our priorities? And that being said, I think we are actually, I'm in the wrong profession. I should actually go and be a Ugandan MP, because if they can get 100 million well, there are quite a number. It's alleged anyway. It's alleged, and that it's for, actually, it's given to them to pass certain legislations. I think also there is a clarification that this money is actually to help them amongst in their constituencies to help people. I don't know, there's quite a lot that is going on about it, but I just like to stick to the health part of it. And in my opinion, I was just wondering, recently I was seeing a foundation that was trying to raise money for children to get heart surgery, children that are born with heart deformities, for them to be flown all the way to India to go and get that treatment. and I'm like 100 billion. That is 55 billion set aside. How much can that go? How far can that go? And in my thinking, I'm like, no, they can't do that. They can't. Like, they're part of us. They're part of the country as well. They're part of Uganda, so they know the pains that we have, And this particular move coming at a time whereby even USAID pulled out their funding. I'm like, no. These guys are our leaders. They represent us, and they feel our pain. They know the pain points in the healthcare system. Now, I'm doing this for the healthcare system, but the same analysis and the same juxtaposition can also be done for the education system, for the transport system, for the disaster and preparedness system. Because recently the entry roads to the city were flooding, and for me, everywhere I see such things, I just bring out my public health lens, and I'm like, the diseases that can come out of this in a place where we don't have money and the funders are actually cutting the funding, we cannot be choosing to give MPs 100 million just like that for let alone Chitezi. Like, the news is still flooded with the fact that we are yet to actually find a long-lasting solution for our rubbish and our garbage disposal. And the looming questions, apart from the fact that we got the ultimate consequence of people actually losing their lives by the landfills actually dissociating from their places. What about the diseases? The diseases that are going to come from that. And we're choosing to give MPs 100 million. From a public health standpoint, I'm like, really, for those that are actually trying to hold their fellow MPs accountable to this, as in, big ups to you. I think I've seen Mr. Joelson, when you're trying to do something about that. It helps us sit in the delusion that these guys care for us, and they are our leaders, and they are the voice of the people, and they will do the right thing. But when I see the health sector ailing, when I see young children actually denied a lifetime of, or denied even growth, denied a good life, the quality of life that they deserve, because they need just one surgery, and someone can get 100 million with the salary that they get. I will leave it at that. But as a public health practitioner, these are things that actually run around in my mind, and also know to see that we still have a deficit in our budget. Like, our health budget is always at a deficit, and these 55 billion that can be placed towards giving people money. I think we need to reevaluate certain things. We need to reevaluate certain things, and also the civic population needs to start holding some of these people accountable. It cannot be a one man's job. These are conversations that need to be had. Because at the end of the day, the health worker without the drugs in the hospital is the one that is suffering. I know one other thing is that health workers, the biggest resource for the health sector is the health workers. Yes, I'm a health worker as well, and I know the biggest resource is the health workers. And this particular money, we know that we have over a 60 billion deficit for HR, for human resource in the health sector. Interns are always striking because they need to be compensated for the time that they give in to treat people and to work in various health centers across the country. And they say that there is no money. Then there's 100 million for every MP. How much are the interns asking for again? So where are our priorities? What are the priorities? I think I just wanted to come and set a conversation on this. I'll be having bits and pieces of public health. This is the public health segment of my channel, so I'll be having bits and pieces of this. But let's have this discussion. So, what do you think about the MPs getting this money, and in the different sectors that you're in, the different places, education, transport? How far can this money go? How far can this money go? I'm bringing the health lens to it, or the public health lens to it, but I'm sure like this particular amount of money could do quite a lot, and for this legislative body not to see this, for some of them not to actually consider this, is something that is far beyond me. It's beyond me. Like, do we live in the same country? Anyway, guys, if you watched this far, I'm just trying to start conversations on this as well. This is it's a new YouTube channel anyway, Charity Clear, building tables with Charity Clear, and I have I talk about life in general, relationships, bits and pieces of public health, because I am a public health practitioner, and faith as well. So please subscribe to my YouTube channel, subscribe, give me a hands up, and most especially let's engage in the comment section, as in, oh, what can this money do in your constituency, in your location, and in the field in which you're serving? Yeah. So thank you for watching. Bye.